This video will go over cerebral vascular disease, or CVAs, which are cerebral vascular accidents. We'll look at different types of strokes, and then we'll compare the signs and symptoms with heart attacks, and then what are prevention, a little bit on prevention. So when we talk about strokes, or CVAs, it's basically when there is a disruption of the blood that supplies the brain, and those are usually initially in the carotid arteries. Some people call strokes a heart attack of the brain because it's similar in the fact that you have a reduction in blood supply, usually through a clot or through a narrowing of the artery. There are three types of stroke. A hemorrhagic stroke happens when an artery in the brain leaks or ruptures. And that, again, is associated with high blood pressure. Ischemic types of strokes are the most common, and that's when the actual artery itself becomes blocked with a clot. A TIA, or a transient ischemic attack, is sometimes called a mini stroke. And it's different than the major types of stroke because the blood flow to the brain is usually only blocked for a short period of time. So the symptoms may come and go. But generally we say that a TIA is a warning sign of a future stroke, and you should seek medical help just like you would if you suspected a hemorrhagic or an ischemic type stroke. The video that I would like you to watch, I will put the URL in the assignment. It's a 2 or 3 minute video that's very good going over the signs, symptoms of a stroke. But they are different than a heart attack in the fact that a heart attack, usually you get some type of chest pain or pressure that radiates up and over the shoulders and down the arms. That's the classic sign, along with sometimes some uncomfortableness in the upper body, and nausea, vomiting, shortness of breath. With a stroke, however, perhaps you might see some paralysis or some slurred speech or difficulty seeing, and those correlate with the area of the brain that's been affected. So they're very different symptoms. Generally, someone that has a stroke may be conscious but won't be able to answer you or won't be able to follow your directions. With both heart attacks and stroke, the best thing you can do is call 911. The faster a person gets treatment, the faster they can get some specific types of medication that can help either break up the clot or do less damage to the heart and or the brain tissue. A person with a stroke may have to go through some different types of therapy. If their speech was affected, they'll go through physical therapy. They may have difficulty with memory and learning basic skills. That would be occupational therapy. They may have some paralysis on one side of their body, and they would have to go through physical therapy to regain some of those movements. We talked a little bit about prevention of cardiovascular disease, but I'd like to point out that the DASH diet increases potassium and decreases sodium, which is different from the past. We thought that reducing blood pressure and putting less strain on the heart correlated more with sodium, and we're finding that if you up your potassium in your diet from fruits and vegetables, that we get a better response in blood pressure. In terms of the other risks, in terms of the other behaviors that you can change, we've reviewed a lot of these, but I'm going to ask you a question in your assignment. What is the FIT principle for cardiovascular fitness? Because the type of exercise you do decrease your risks of both cardiovascular or strokes and heart attacks. So your next job is to watch the video in the assignment and answer the 3 questions. You will have a week to complete this gap video. See you in class.